Bismillahirrahmanirrahim. Rabbi zidni ilm. The Expert in Everything was once a beginner by Helen Hayes. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq and under the supervision of Professor Dr. Sarah Sir. Today my topic of presentation is tetanus. Learning outcomes include the introduction, epidemiological triad, chain of transmission, clinical stages, level of prevention and recent updates. Learning outcomes. At the end of these presentations, participants will be able to describe about tetanus, epidemiological triad, chain of transmission, clinical stages, along with the levels of prevention. Tetanus, lockjaw, is a serious disease that can cause breathing problems, muscle spasms, and paralysis. Unlike other vaccine-preventable diseases, tetanus does not spread from person to person. It enters the body through cuts or puncture wounds. Introduction. An acute disease induced by the exotoxins of Clostridium tetani and clinically characterized by muscular rigidity, which persists throughout illness, punctuated by painful paroxysmal spasm of the voluntary muscles, especially the masseter, trismus, or lockjaw, the facial muscle, recus sardonicus, the muscles of back and neck, opisthotonus, and loose of the lower limbs and abdomen. The mortality tends to be very high, varying from 40 to 80%. So it is usually due to the contamination wound, the Clostridium tetani bacteria is the agent which releases tetanus neurotoxins, and then it leads to severe hyperextension and spasticity caused by the neurotoxin by Clostridium tetani. So you can see the picture of this patient as well as the second picture. So talking about the tetanic triad, it includes the trismus, which is the lockjaw. It could be mild or severe. Then the recus sardonicus, which is Sardinian grin. Grin is caused by the facial muscle spasm. And then the opisthotonus, which is severe simultaneous spasm of all muscles. So this is the tetanic triad. Problem statement. Tetanus is now comparatively rare disease in the developed countries, but neonatal tetanus is still a killer disease in developing countries. Even with treatment, the case fatality rate can be as high as 80 to 90%. It tends to occur in areas with poor access to healthcare. Talking about the epidemiological triad, it is between agent, host, and environment. Agent factor. Agent is Clostridium tetani, is a gram-positive anaerobic spore-bearing organism. The spores are terminal and give the organism a drug-stick appearance. The spores are highly resistant to a number of injurious agents, including boiling, phenol, chrysos, and autoclaving for 15 minutes at 120 degrees centigrade. Reservoir of infection. The natural habitat of the organism is soil and dust. The bacilli are found in the intestine of many herbivorous animals like cattle, horses, goats, and sheep and are excreted in their feces. The spores survive for years in nature. The bacilli may be found frequently in the intestines of the man without causing ill effects. The spores are blown out in the dust and may occur in a variety of situations, including operation theaters. Exotoxin. Tetanus bacilli produce a soluble exotoxin. It has an astounding lethal toxicity exceeded only by botulinum toxins. The lethal dose for a 70 kg mass is about 0.1 milligram. The toxin acts on 4 areas of the nervous system. Number A, motor and pacing skeletal system, the spinal cord, the brain, and the sympathetic systems. Its principal action is to block inhibition of spinal reflexes. The period of communicability is none, and it doesn't usually transmit from person to person. Talking about the host factor, age, it is a common disease of active age, like 50 to 40 years. This period predisposes to all kinds of trauma, and therefore the risk of acquiring the disease is pretty high. Sex, although a higher incidence is found in males, females are more exposed to the risk of tetanus, especially during delivery or abortion, leading to puerperal tetanus. Males appear to be more sensitive to tetanus toxin than females. Occupation. Agriculture workers are at special risk because of their contact with soil. Rural-urban difference include the incidence of tetanus is much lower in urban than in rural areas. Immunity. No age is immune unless protected by various previous immunization. This immunity resulting from 2 injections of tetanus toxin is highly effective and lasts for several years. Immunity lasting for a few weeks, less than 6 months, can be transferred to the baby. If the mother is immunized during pregnancy or she has already had high level of immunity at the time she becomes pregnant. Tetanus is one disease in which herd immunity does not protect the individual. Environmental and social factor. It is a positive environmental hazard. Its occurrence depends upon man's physical and ecological surroundings. The environmental factors are compounded by social factors such as unhygienic customs and habits, like application of dust or annual dung to wounds, unhygienic delivery practice like using unsterilized instruments for cutting the umbilical cord, ignorance of infection and lack of primary healthcare services. Mode of transmission. Infection is acquired by contamination of wounds with tetanus spores. The range of injuries and extents which may lead to tetanus comprise a trivial pinprick, skin abrasion, puncture wound, burns, human bites, animal bites and stings, unsterile surgery, intrauterine death, bowel surgery, dental extractions, injections, unsterile divino umbilical cord, compound fracture, otitis media, chronic skin ulcers, eye infection, and gangrenous limbs. Incubation period. It is usually from 6 to 10 days. However, it may be as short as 1 day or as long as several months. Long incubation is probably explained by the spores lying dormant in the wounds. Incubation is also prolonged by prophylaxis. Talking about pathophysiology, it is a tetanus is an infection disease caused by Clostridium tetani bacteria. The active anaerobic bacteria lead to the production of tetanus toxin, which enters the nervous system via lower motor neurons and travel up to the spinal cord and brainstem. The spores become active bacteria that spread in the body and makes a poison called tetanus toxin, which is tetanospasmin. This poison blocks nerve signals from your spinal cord to your muscles, causing severe muscle spasms. The spasms can be so powerful that they tear the muscles or cause fractures of the spine. Clinical features. On average, it takes about between 7 to 10 days after infection of symptoms of tetanus to develop. The symptoms can appear anywhere between 4 to 21 days after you have been infected. The first symptom of tetanus are usually stiffness and mild spasm in the jaw muscle or jaw cramping. Sudden involuntary muscle tightening, muscle spasms often in the stomach. Painful muscle stiffness then occurs all over the body. There is trouble swallowing, jerking of sears, headache, fever and sweating, changes in blood pressure, and fast heart rate. So you can see the common symptoms are lockjaw, difficult swallowing, shortness of breath, and body spasms. And these are the showing all the symptoms of the tetanus, like in this intact sensorium, but there's headache, difficult swallowing, sore throat, irritability, tonic spasm of facial muscles, jaw stiffness, fever, restlessness, chills, exaggerated reflex, and profuse sweating. And prevention is childhood immunization. Types of tetanus. Traumatic. Trauma is a major important cause of tetanus. Sometimes tetanus may result from most trivial and even unnoticed wounds. Puerperal. It follows abortions more frequently than normal labor. The post-abortal uterus is a favorable site for the germination of tetanus spores. Autogenic. EM may be a rare portal of entry. Foreign bodies such as infected pencils, matches, and beads may introduce infection. Autogenic tetanus is a pediatric problem, but cases may occur in adults too. Then the last is idiopathic. In these cases, there is no definite history of sustaining an injury. Some consider it to be the result of microscopic trauma. So the different types of tetanus, generalized, neonatal, local, and cephalic. Talking about the neonatal tetanus, also called tetanus neonatorum, is a generalized tetanus that results from infection of a neonate. It primarily occurs in underdeveloped countries and accounts for as many as half of the all neonatal deaths. The first sign of tetanus in a neonate is usually an inability to suck or breastfeed or excessive crying. Characteristic feature trismus, which is lockjaw, or inability to open the mouth. Then the rhizus tonicus, which is forced green and raised eyebrows, and opisthotonus, which is backward arching of the spine. Diagnosis. There is no specific laboratory test existing for determining the diagnosis of tetanus. The diagnosis is based clinically. However, the pro-tetanus test kits can be used to determine whether an individual patient has a sufficient level of immunity to be protected against tetanus. It is used in Europe under the name tetanus quick stick and has been validated against ELISA measurement of the serum tetanus antitoxins level. TQS takes 10 minutes to read and 100% specific or tetanus antibodies. If the test is positive, you can assume the patient has protection against tetanus for at least 5 years. Sensitivity is 55% for titers of 1.0% international unit per annum, but 100% if titers are more than 0.5 international unit per ml, which is 5 times greater than the expected protective limit of 0.1 international unit per ml. Moving towards the level of prevention, as we see the hierarchy, the base is primordial prevention, primary prevention, secondary prevention, and tertiary prevention. But in this case, starting with the primary prevention, which includes the health promotion. Tetanus germs can enter the skin through something as small as pinprick, but they prefer deep wounds. Clean any wound you get with the soap and water, then use an antiseptic. If the wound is dry or dirty, you have doctor to check it out. If you haven't had a tetanus booster in more than 5 years, you may need to get another booster. Be sure to give your vaccine record to your healthcare provider. Specific protection. Tetanus is best prevented by active immunization with tetanus toxide. It stimulates the production of protective antitoxins. The aim should be to vaccinate the entire community and ensure a protection level of antitoxin approximately 0.01 international unit per ml serum throughout life. All persons should be immunized regardless of age. Tetanus vaccination schedule in Pakistan. The vaccine is administered to infants in 5 doses, like 2 months, 4 months, and 6 months. 18 months of the age, and then the child is 4 to 6 years old, followed by a booster dose every 10 years. And then it is recommended that pregnant women receive the tetanus toxoid between 27 and 36 weeks of pregnancy. For the vaccination of the female, there are 5 doses which are required. TT1, 2, 3, 4, 5. TT1 is given during the first pregnancy. Tetanus toxoid is given 1 month after the first dose, and then TT3 is given 6 months after the second dose. And then TT4, 1 year after the third dose, and fifth one, 1 year after the fourth dose. Tetanus vaccine. People of all ages need tetanus vaccine. For young, it is DTaP, the ages I mentioned. Then for preteens is Tdap, and TD or Tdap for adults every 10 years, which is recommended by CDC. 2 preparations are available for active immunization: a combined vaccine, DPT, and monovalent vaccines, which is plain or fluid toxoid or tetanus vaccine absorbed, PTAT or APT. Combined vaccine. The primary course of immunization, 3-dose DPT, 4 weeks, 8 and 6 weeks, followed by a booster 18 weeks a month. The second is 5 to 6 years of age, and then third booster TT only after 10 years of the age is given. Monovalent vaccine. A primary course of immunization consists of 2 doses of tetanus toxoid absorbed, each dose 0.5 ml injected into the arm, given at the interval of 1 to 2 months. The longer the interval between 2 doses, the better is the immune response. The first dose, booster dose, the third in order, should be given a year later after the initial 2 doses. Purified tetanus toxoid should be stored between 4 and 10 degrees Celsius. It must not be allowed to freeze at any time. Temporary protection against tetanus can be provided by an injection of human tetanus hyperimmunoglobulins, TIGs or ATS. Human tetanus hyperimmunoglobulins, it is the best prophylactic to use. The dose of all ages 250 international units. It does not cause serum reaction. It gives a longer passive protection up to 30 days or more complete as compared to 7 to 10 days for horse ATS. ATS equine. If human antitoxin is not available, equine antitoxin, which is anti-tetanus serum or ATS, should be used. The standard dose is 1500 international units injected subcutaneously after sensitizing testing. ATS gives passive protection for 7 to 10 days. Being a foreign protein, ATS is rapidly excreted from the body, and there may be very little antibody at the end of second week. Active and passive immunization. Simultaneous active and passive immunization is widely carried out in non-immune persons. The patient is given 1500 international units of ATS or 250 units of human immunoglobulin in 1 hour and 0.5 of ml of absorbed tetanus toxide into the other arm of glutathione. This should be followed 6 weeks later by another dose of 5 ml tetanus toxide, third dose 1 year later. Adults should get a TD booster once every 10 years throughout their life. This is true even if you don't have a wound. Getting a TD booster every 10 years applies if you have a minor clean wound. Antibiotics. A single intramuscular injection of 1.2 mega units of long-acting penicillin like benzathine penicillin will provide a sustained concentration of the drug for 3 to 4 weeks, which is sufficient to kill any vegetative form of tetanus bacilli that may emerge from the sporulating stage. Penicillin has no effect on tetanus spores. Prevention of neonatal tetanus. In unimmunized pregnant women, 2 doses of tetanus toxide should be given. The first as early as possible during pregnancy, and the second at least a month later and at least 3 weeks before delivery. Immunized pregnant women, a booster dose is considered sufficient. There is no need for a booster at every consecutive pregnancy because of the risk of hyperimmunization and side effects. These are the recommendation of prevention of tetanus in the wounds. You can see wounds less than 6 years or 6 hours old, clean, non-penetrating, and with the negligible tissue damage and other wounds. So there is immune categories which is A, B, C, D according to the course taken of the toxin and booster within 5 years, 10 years, and according to it, the treatment is justified. If it is category A, which means had a complete course of toxin or a booster dose within the last 5 years, then nothing more is required. And if the category B, like it is a complete course of toxide, but more than 5 years, but less than 10 years, then toxide 1 dose is required. And in the category C, it has complete course toxide, but more than 10 years, then again, toxide 1 dose is required. And in case of D, the code, they've never been immunized, or in that case, it is unknown, then toxide complete course is being given. Same in the case if they say, in the case of wound, less than 6 are clean and non-penetrating. In other wounds, you can see A, B, C, D, but nothing is required here. 1 dose. In this, we combine different vaccinations in case of other in cases of other cases, deep wounds or contaminations and everything. So secondary prevention. Tetanus has no definitive cure, but it can be treated with surgery to clean an infected wound. It is also treated with anti-tetanus and anti-spasm medicines and antibiotics. One may need ventilator until someone can breathe well on his own. Tetanus is treated in intensive care units. Even with modern medical care, tetanus can be fatal. From 1 in 10 out to 1 in 5 people with tetanus may die from it. Complications can include breathing problems, broken bones, blood clots, and pneumonia. For people who survive recovery, can take several months. Nerve damage may take even longer to heal, or it may be long-term, which could be permanent. So protecting all against tetanus, starting with the antenatal delivery and the vaccination immunization of the kid and throughout the life. Recent updates. Talking about tetanus vaccine by CDC, there are 4 kinds of vaccines are available, which is diphtheria and tetanus, DT vaccines, diphtheria, tetanus, and pertussis, DPT vaccines, tetanus and diphtheria vaccines, and tetanus, diphtheria, and pertussis vaccines. So these 4 types of the vaccines are available, which are used for the vaccination of different age categories. In Pakistan, there's vertical program of EPI, expanded program of immunization, to protect the children and women against vaccine-preventable disease through vaccination. So in this case, if we see the VN is to achieve the universal immunization coverage, leaving no one behind to die from vaccine-preventable diseases, and mortality from vaccine-preventable disease should be less than 1% of the total child mortality. In the objective, you can see one objective is to decreasing deaths caused by tetanus from 0.03 to 0.01 per 10,000 newborns by 2024. So it is one of the objective of in API. Fast facts on global tetanus. Maternal and neonatal tetanus is a public health problem in 12 countries, and tetanus still affects people globally. Worldwide, 75 million women and their babies remain unprotected against maternal neonatal tetanus. In 2019, global burden of disease estimated over 73,000 total tetanus cases, including over 27,000 neonatal tetanus infections. A modeling study found that during January to December 2020, an estimated 30 million children missed completely their third primary dose of tetanus containing vaccine. Several countries still do not provide test and booster shots to protect their population throughout life. So tetanus causes serious health problems, and in countries with no intensive care, almost 100% of the people who get infected with tetanus will die. So tetanus is preventable with a safe and cost-effective vaccine. The schedule is being given, and according to WHO, the first 3 doses at the age of 6 weeks completed by the age of 6 months with at least 4 weeks between doses. Another 3 doses boosters are recommended at the age of 12 to 13 months, 4 to 7 years, and 19 to 15 years. For lifelong protection, ideally booster shots are given at least 4 years apart. So tetanus vaccine is highly cost effective. The cost of delivering one tetanus vaccine dose is estimated less than $1 in developing countries, and it saves lives. Tetanus vaccination program contributed to a 95% reduction in neonatal tetanus deaths in last 30 years and continued to decrease tetanus burden. Thanks to vaccination, neonatal tetanus currently account for less than 1% of major causes of neonatal deaths, a significant decrease compared with 7% contribution to all-cause neonatal mortality in 2000. The surveillance. Tetanus becomes nationally reportable in 1947. Health departments suppose cases of tetanus to a neonatal notified disease surveillance system. Public health officials conduct tetanus surveillance to monitor trends in incidence, identify population at risk. Talking about the trends in the United States, you can see in this picture from 1947 to 2000, and you can see the gradual decline from 1947 to 2020. Moving towards the multiple choice questions. A patient ABC was admitted in psychiatry ward. All of a sudden, he started to behave abnormal and had sudden contraction in his body. Doctor on duty made clinical diagnosis of tetanus. Which among the following is not a common symptom of tetanus? Decreased heart rate, profuse sweating, difficult swelling, muscle spasm, fever.
A.
Yes, A is the correct answer because there is activation of sympathetic system. So there is high heart rate. A farmer ABC was working in a rice field barefoot. Suddenly he got a minor injury on his left foot and there was a mild bleeding from site of injury. What is the best approach to be taken during this situation? Immediately go to tertiary care, wash and take some rest, wash wound and go to nearby doctor, ignore this later wound and apply mud on the wound.
C.
Yes, C is the correct answer. Females are more exposed to the risk of tetanus, especially during delivery and abortion, leading to puerperal tetanus. When can a woman with the tetanus pass this disease on to another person? A. After delivering placenta from an open wound, while the scale is visible, when fever is settled, when she is fully immunized. In this case, the answer is E. From the open wound, and the spores are present and the wound is open, the spores can be grow in the environment, and the separate caretaker and some person is there with the minor wound or cut on it, and he may get infection. So, B is the correct option. The pro-tetanus test kits can be used to determine whether an individual patient has a sufficient level of immunity to be protected against tetanus. That kit is called TQS and is used mainly in developed countries. Regarding tetanus quick sticks, which option is correct? It takes 1 hour to interpret. If the test is positive, the patient has contracted tetanus. They are 100% specific for tetanus antibodies. They are 80% sensitive for titers of 0.01 international unit per ml and 100% sensitive if titers are less than 0.5 international units per ml.
D.
No, the correct option is C. These TQS are 100% specific tetanus antibodies. A person after falling from tree got injury on big toe. He is at great risk of getting tetanus, an acute disease induced by the exogenous Clostridium tetani. Tetani is best prevented by active immunization. This immunization drug belongs to which group? Live attenuated vaccine, heat kill vaccine, formalin kit vaccine, toxoid vaccine, and messenger RNA.
D.
D is the correct answer, toxoid vaccine. Tetanus is very dangerous infection caused by the Clostridium tetani. Very rarely a person can get exposed to that through an intact skin. Once exposed to the infection, a person can develop the disease in as little as first day, fourth day, sixth day, eighth day, or 10th day. Any guesses? The correct option is first day. A child was born to an unimmunized woman who had developed neonatal tetanus and died within a week after birth. That woman was immunized later on. Which among the following is recommended for her subsequent pregnancies to be prevented from tetanus? 2-dose vaccine before delivery, tetanus toxoid before last 30 days of delivery. No vaccine is required at all. Booster dose should be given once, vaccine just after delivery. D is the correct option. If the patient is
B.
vaccinated, then the booster dose should be enough for her. So D is the correct option. A newborn was brought to pediatric emergency of Mayo Hospital having difficult breathing and muscle spasm. He was admitted in the hospital with the clinical diagnosis of tetanus neonatorum, and doctors decided to give him a mechanical ventilation support system. Diagnosed as neonatal tester, what is the first sign of this disease in the newborn? Forced grin, raised eyebrows, decreased cry because of tense muscle, inability to suck breast milk, or locked jaws.
D.
D is the correct option, inability to suck breast milk. A cold chain is a set of rules and procedures that ensure the proper storage and distribution of vaccine to health services from national to local level. An unbroken cold chain is an uninterrupted series of unrefrigerated production, storage, and distribution activities. For tetanus toxoid, the appropriate temperature should be 4 to 7 degrees Celsius, 4 to 7 degrees Fahrenheit, 6 to 8 degrees Fahrenheit. Freezing is ideal, no cold chain is required.
B.
The correct option. Last but not the least, the single intramuscular injection of 1.2 mega units of a long-acting penicillin, like for example benzathine penicillin, will provide a sustained concentration of drug for 3 to 4 weeks and might help in relieving the symptoms of disease. Regarding its mode of action, which is true, penicillin acts directly on spores of Clostridium. Penicillin is given to reduce superimposed bacterial infection. It acts on vegetative form of Clostridium. It acts on superimposed fungal growth. It acts very fast to control lockjaw. C is the correct option. It acts on vegetative form of Clostridium. This is the key. This is the YouTube link. And thank you so much.